From empty streets in lockdown Shanghai to bells tolling out 1 million deaths in the United States, the coronavirus pandemic is far from over.
I continue to call on Congress here at home to take the urgent action to provide emergency COVID-19 funding that is vital to protect Americans.
The White House asked for the supplemental funding from Congress in early March, including a request for $5 billion for global initiatives during the second annual Global COVID-19 Summit.
The United States will share critical COVID-19 technologies through the World Health Organization COVID-19 Technology Access Pool. We're making available health technologies that are owned by the United States government, including stabilized spike protein that is used in many COVID-19 vaccines. We're standing up a new pilot program, working with the Global Fund to expand access to rapid testing and antiviral treatments for people in harder to reach areas.
Biden initially asked Congress to include his COVID funding request with his $33 billion request for Ukraine aid, but had to agree to separate the two to get aid to Ukraine passed quickly. The top Republican on the Senate Foreign Relations Committee told VOA it's a matter of competing priorities under a limited time frame.
As with everything, dollars and cents always come into play. The decoupling was done because we wanted to move the Ukrainian issue much more quickly. I wouldn't say that that in any way should be looked at as demeaning the COVID question.
The U.S. has already provided more than $14 billion in funding for global COVID initiatives since the pandemic began in December 2019. There are concerns the U.S. has already spent too much. Senate Foreign Relations Committee member Tim Kaine telling VOA he worries the bill will not include enough funding for vaccine diplomacy.
It was really helping us after years of China being more aggressive in the Americas than us, the fact that they were selling lower quality vaccines and then often canceling the contract if somebody said something nice about Taiwan, and we were giving the highest quality vaccines with no strings attached. We were starting not only to help people, but really win back a little bit of a diplomacy deficit that we had allowed to grow over the years.
U.S. lawmakers are set to begin work on that COVID bill in the coming week. Catherine Gibson, VOA News, Washington.